Well, I'm joined now by Sam Rose, the Senior Deputy Director of UNRWA Affairs in Gaza. Welcome to you. Good to have you on the programme. How has the rollout gone today?
Thank you. Look, the rollout has gone well today, certainly as well as can be expected. It started a long time ago in terms of preparations, but our clinics opened. They were due to open this morning at 8 o'clock. Many of them opened earlier than that because the crowds of people outside were waiting to get in. And we estimate tens of thousands of people, of children under 10, were vaccinated today. From what I could see, I went to UNRWA clinics. I went to shelters, which are UNRWA schools, where people have been seeking refuge for the past several months, and we could see orderly queues, small children with their parents waiting for the vaccinations. We don't have the numbers yet in terms of how many children we've reached today. As I say, we estimate in the tens of thousands, but there's a long way to go.
Yeah, I was going to say 640,000 over the course of a few days. That's the aim. How confident are you that can be achieved in that time frame?
We have to make this work. I mean, today was a start. It allows us to adjust. Tomorrow will get more difficult because we start tomorrow vaccinating children outside of these self-declared safe zones. Now, the fighting ceased today. There was an eerie quiet on the streets at 6 o'clock this morning, a sense of respite. But just the past few minutes, I've heard more bombs. Tomorrow, we'll have to venture in to areas that are not subject to this pause in hostility. That means our staff have to get there, several hundred staff involved in administering the vaccines, but more importantly, the parents and their children. And the idea that you take your infant child to a vaccination when you're being bombed, when you're in fear of your life is, I mean, it's an impossible dilemma. And we've got not just this area of Gaza we've got to complete over the next 4 days. We'll then move to southern Gaza, and then a more difficult part in the north, where overall population numbers are somewhat unknown. They're unknown everywhere in many ways because we don't know precisely how many children are here. Many thousands, we believe, buried under the rubble. But we are committed as a system. I want to pay tribute to all the staff who've been involved in it, all the health professionals working day and night to get the first day of the campaign off to a success.
And are you confident that this will work, that it's being done quickly enough to prevent further cases of polio?
We're doing it as quickly as we can. It was in some ways a shock that the first case re-emerged and was confirmed a few weeks ago. But in other ways, it's inevitable given the circumstances in which people are living. A whole healthcare system that's been decimated. 90% of the population relocated, displaced. Many hundreds of thousands have lost their homes, living amongst sewage, amongst garbage with no water, suppressed immune systems and malnourished. It was absolutely inevitable, sadly, that this or something like it would break out. And the children who were vaccinated today, they've gone back to those same tents. So we may and we hope we will be able to protect them from polio. We're confident of that. But if it's not polio, it will be something else until there is an end to this war, until the hostage is released, until people can start picking up the pieces.
How quickly does the vaccination actually work?
Well, we need to do one phase now, and we've got 4 days in three zones of Gaza, so essentially a 12-day period. Then to get full immunity, we have to do a second phase of vaccinations in 4 weeks' time. We'll have to go again through the same process of coordinating vaccines into Gaza, the movement of them around, and critically these pauses so that the parents can reach the centres and people can get there to administer the vaccines. And it can spread very quickly, and it has lifelong consequences, not necessarily death, but paralysis, loss of movement, and really limited life prospects for those who contract it, particularly in an environment where the health system has been so affected, so decimated over the past several months. So the prospects for anyone getting it are really dire.
Sam Rose, thank you very much for being with us and taking us through that operation. Thank you.